a year from now, what would be something that you'd be able to share with the audience that was new in your field, something that is just beginning now, and that might be just the glimmerings, either the glimmerings or advanced results in whatever discipline, whether it's more communication, whether it's groundbreaking research, whether it's a hope for some things that are starting to percolate. Each of you would talk about the work that you're doing that is exciting. Dr. Lowy?
Well, I would pick cancer screening. I think we are going to end up in an era where the precision of cancer screening will go up, the range of cancers for which we will have cost-effective testing will also go up. It won't be for everything, but we will see incrementally improvements in this area, and some of them may be dramatic.
So as luck would have it today, Color launched a $149 BRCA1, BRCA2 test. And a few years ago, that same test would have cost almost $4,000. And we're actually running a promotion for Breast Cancer Awareness Month to do it for $99 with $50 testing of at-risk family members. And this is it's a physician-ordered test. It's a clinical grade test. You get access to board-certified genetic counselors every step of the way to help you understand the results and help guide you to your next steps, and to work with your physician to make a preventative plan if you get a positive. And so what I would like to see is, and this is a quote actually from Dr. Mary Claire King, who recently wrote an opinion piece where every woman over the age of 30 should be getting BRCA1/2 testing. That in 2017, and definitely in 2018, there's no reason that any woman with a BRCA mutation should be dying of breast and ovarian cancer.
Dr. Burrow.
I would, to take off on Dr. Lowy, I think we're going to have more screening tests. We're going to have a blood test looking for circulating DNA fragments that might indicate a person has an early cancer. I just hope that we actually validate these tests to actually show that they save lives before we start implementing them in the population the way we have with screening tests in the past. And then 20 years later realize that screening test actually doesn't save lives.
So what we are currently doing, we're already demonstrating that using deep learning and the raw data that we're collecting, like mammograms or pathology slides, can already make some really important predictions. What I would like to see in a year, and I believe we can do it in a year, is to provide full probabilistic progression of the disease so that we can reliably say, for women who is going to get cancer need to be screened differently, who doesn't need to be screened because their likelihood is so low, there is no point for them to come every year. And for people who unfortunately got cancer, to provide, again, likelihood of recurrences and the sensitivity to treatment.